When we think of beauty pageants, we usually picture something exactly like this: glitz, glamour, and a stage full of colorful costumes, all focused on a highly polished aesthetic performance. But behind those lights is a different set of numbers: the tens of thousands of women who die from breast cancer every single year. The medical consensus on how to fight this is clear: early detection works. A yearly screening using a mammography machine like this one is a proven life-saving measure, especially for women over 40. Yet, despite knowing how well these screenings work, standard medical advice isn't reaching everyone. There is a massive disconnect between the urgency of doctors and the actual number of women walking through clinic doors. The disconnect comes down to three hurdles: fear of a positive diagnosis, lack of time, and the crushing weight of medical costs. Data shows these costs disproportionately block women in low-income neighborhoods, hitting the African American community especially hard. Without access to early detection, women in these specific demographics are statistically driven toward much more severe late-stage cancer outcomes before they ever receive treatment. Research into low-income areas shows that these women often lack physical and financial access to testing, suggesting that standard clinical messaging is effectively stopping at the zip code line. That unconventional approach began in the early 2000s with Marcia Mickens. Getting ready for work one morning, she heard a radio broadcast about community service that sparked a sudden drive to find her own way to give back. She had two highly specific skills to draw from: a professional background in event planning and a personal passion for competing in beauty pageants, a hobby she had just picked up in her early 40s. Before she could act on that drive, her routine was interrupted by a terrifying, though ultimately benign, breast cancer scare. Navigating that scare opened her eyes to what was happening in her own neighborhood. The women around her were actively neglecting their yearly mammograms, blocked by the exact same fears and financial barriers we mapped out earlier. That relief turned into a focus on the larger problem. She saw that her personal scare was a mirror for a much wider systemic breakdown in how health information was being shared. In 2003, she figured out how to address that failure by merging her expertise in running large-scale events with her newfound focus on health outreach. Marcia established the U.S. United Pageant. Instead of purely judging evening gowns and talent routines, she hardwired breast cancer awareness into the organization's foundation as its mandatory central platform. She used her own close call to anchor the message, sharing her story, to demystify the screening process for the contestants on stage and the audiences sitting in the crowd. The strategy effectively used the inherent glamour and loud attention of a pageant as a delivery mechanism. It bypassed the sterile intimidation of a clinic, bringing life-saving information directly into underserved communities. By reframing medical advocacy inside a celebratory, culturally relevant environment, the pageant successfully engaged the exact demographics that traditional outreach had left behind. Today, that initial platform has grown far beyond a single founder's mission, creating a nationwide multiplier effect. The contestants and reigning queens branch out, using their titles to organize independent volunteer initiatives and raise funds for localized cancer research. Because these advocates come directly from those vulnerable communities, they provide a level of trusted, peer-to-peer encouragement that institutional medicine simply cannot buy. The pageant acts as a self-sustaining social engine, continuously recruiting women and deploying them back into their neighborhoods as active health advocates. The goal driving this entire network is remarkably straightforward: proving that with access to early detection and treatment, a woman does not have to become a fatal statistic. Marcia's method bypassed the usual routes of systemic reform. She proved that executing a highly effective public health intervention doesn't require a medical degree or a political office. You can build a system that saves lives just by taking the things you already know how to do and pointing them directly at the people who need them the most.